Welcome everyone to IsisParenting's Sleep Support webinar and chat. My name is Nancy Holtzman. I'm a mom and baby nurse educator, board certified lactation consultant, and board certified in pediatrics. And I'm here just outside of Boston, Massachusetts at IsisParenting's home office in Needham. We have 4 centers in the metro Boston area. We're opening 5 centers in Dallas, Fort Worth, and 4 more centers in the Atlanta area before this summer. So if you're close to one of those areas or have friends or family, please do help us spread the word. I'm the mom of 2 older teenagers, and with me today is my friend and colleague Meg Casano. And Meg is the mom of 4 beautiful daughters, all under the age of 6. And I'm here in Boston, and Meg is on so-called vacation in Florida today. And that's the beauty of having a virtual program. The beauty, and as anyone who works at home knows, that your work really travels with you. You never truly get a day off. But I can't speak for Meg, but I can certainly tell you that I absolutely enjoy my work, and I don't mind answering questions and thinking about moms and babies at midnight or at 6 a.m. And I'm sure that many times Meg feels the same way.
I do.
But it is good to actually separate yourself and shut off sometimes. So, Meg, I know this is a huge topic today, and I have to tell you, as I said by email, I was just overblown with the gorgeous photos that I received yesterday, and I think that every single photo in this web deck today is brand new and sourced from yesterday, with the exception of, I think, one photo we've used before and one of our favorite photos. But lots and lots of beautiful new pictures, and those of you who would like to contribute photos to the breastfeeding and sleep webinars, please do so. Usually I recruit for them over Twitter. If you're not on Twitter, what's wrong with you? No, if you're not on Twitter, then let me know here, and I can give you my email address privately, and you can send some very clear, crisp photos, and we will use them, and you can watch them. Meg, so why don't we get started so we can talk about this topic people are so eager to hear about, and then answer a few questions.
Okay, great. Thanks, Nancy. I'm going to jump right in because we have a lot to cover today, but I'm so excited to talk about this. Okay, so today we are going to talk about if you're having a nursing to sleep association with your baby, meaning your baby relies on you to be nursed to sleep, naps, bedtime, frequently in the middle of the night. This webinar is going to teach you how to learn a new soothing for your baby besides nursing. You won't necessarily learn today how, your baby will still rely on you to be falling asleep. That's okay. This is one step in the path to independent sleep. But this is a huge step because having another repertoire in your soothing, like rocking, singing, bouncing, holding, this is a great starting point to beginning another type of sleep intervention to get your baby to be able to initiate sleep independently when you're ready for that. This also will give you the ability to introduce perhaps new caregivers at bedtime. Maybe you are feeling like you're at the point where you'd like to be able to go out with a friend or go out with a spouse or a partner, and be able to have someone else be able to put your baby down without nursing. So that's what you're going to learn here today, is how to soothe your baby in a new way besides nursing. I thought we should probably just talk for a second about why nursing to sleep could cause some sleep disruption. Basically, what it can do is create some full arousals for comforting by your baby at times, when your baby might be having a normal, natural sleep cycle wake up. You and I do this all the time. We glance at our clock, we fluff our pillow, we roll over, we go back to sleep. For a baby who only knows how to go to sleep with nursing, actually your baby will fully wake up and call for you, and look to nurse again to get your cycle back down into sleep. So it actually can cause more sleep disruption for your baby. It can cause less consolidated sleep. And of course, we're always saying we're looking for sleep consolidation. Those nice, healthy sleep cycles back to back. It can also create with the nursing, the comfort also, creates the milk production, and it can create extra wake up for habitual feedings. What that means is the circadian rhythm, among other things, does cue for digestion at regular times. So even if your baby is older, and perhaps past the point of needing, say, a feeding at 10 o'clock, if your baby's body is used to digesting milk at 10 o'clock, his little tummy really will feel rumbly at that time. So, if he has a normal sleep cycle arousal at 10, let's say, he's thinking, I'm hungry, bring on the milk. And so it sort of perpetuates these wake ups. Also, the overnight urine production is designed to decrease, but having the extra milk can actually keep that process going, can also cause, leaks, stimulating diaper changes, which, of course, makes it more difficult for your baby to get back to sleep too. And then, nursing to sleep, of course, makes it more difficult for mom to have any respite, whether it's from a partner or a spouse in the middle of the night trying to soothe baby back to sleep, or whether, like I said, it's at bedtime. So, it's change worthy. And when you decide that you're ready to address this, you'll always start at bedtime. So, I usually say you don't want to spring this on your baby in the middle of the night. For example, you wouldn't want to nurse your baby to sleep at bedtime when it's actually the easiest time of day to fall asleep. And then later, say at 3 o'clock in the morning, say, okay, now you're on your own. So you're going to start at bedtime first when you have sleep biology working in your favor. Your baby has a higher sleep pressure, that's more sleepiness, and sleep hormones are rising at that point to cause your baby to be able to initiate sleep in a new way. You might want to begin your baby's bedtime about 15 minutes later than you usually do, or than you expected your baby to be able to fall asleep. This increases the sleep pressure without causing extreme overtiredness. And you also will want to make sure you're setting a goal for yourself. Are you just looking to work on your bedtime? So, with your goal being maybe another caregiver can put your baby down. Maybe you just want to work on the first, say, third or half of the night. So you're confident your baby's having a long stretch, a 4 or 5 hour stretch before needing to be nursed back to sleep. Maybe you're looking to do a full night. Some of this will depend on how old your baby is, what goal would be appropriate. Of course, young babies will still need feedings in the night, so you might want to go back and look at some of our scheduling webinars to help determine what's the most appropriate goal for your baby. And then, of course, as I always say, you don't want to plow through feedings cold turkey. If your baby does have extra habitual feedings going on in the night, but he doesn't need them anymore, you would want to reduce them so that you're allowing calories to transfer into either daytime or into more into your later night feedings. And also, you're sort of undoing those habitual hunger cues that get created with the extra nursing on the overnight. Okay, so once you have, made the decision that you're ready to make a change, you're going to start at bedtime. We have I'm going to give you an overview of four basic approaches. These sort of these are all soothing approaches. Some would be, some will go a little faster, some will go a little more slowly. And the first is our very popular Trading Down Sleep Associations. We have a webinar recorded on this topic for to move your baby on the path to independent sleep, and for toddlers as well. This Trading Down Sleep Associations is just as it relates to changing the nursing to sleep association. And so you might want to go back and check out the Trading Down Sleep Associations as it relates to independent sleep. But again, basically, it's alternating back and forth between a position of higher soothing and lower soothing, with the goal being to ultimately end with your baby falling asleep in the low soothing spot. So if you're doing Trading Down Sleep Associations for the Nursing to Sleep Association, it's kind of like a tongue twister, your high soothing for your baby would actually be Latched On for Comfort. And your low soothing for your baby would generally be either held in your arms, maybe rocking in a rocking chair, maybe bouncing on a ball. If you're bed sharing, maybe it's just snuggled up next to you in bed without being latched on. So it is important before you begin trading down that you have a high soothing in your mind, what works for your baby, what soothes your baby, and you have a low soothing in your mind. What is the soothing style that you would like to transition to? Your plan would be that we do generally suggest that you move your real calorie nursing about 30 minutes away from your bedtime, maybe before your bath or PJs, so that you are comfortable, you're confident that your baby is getting a nice feeding for calories before the time that you're actually expecting your baby to fall asleep. You can still do a sort of bonus nursing session, comfort dessert nursing session right before bedtime if you'd like to have that last snuggle and closeness. But now, because you've moved the calorie nursing a little bit earlier, now you're feeling confident that your baby's had enough to eat before bed, and you can be in a little bit more control about when you end the comfort nursing session, because you do want that to end when your baby is still awake. So you would do your bedtime routine. You would end your comfort nursing session if you're choosing to do that with your baby still awake. And now you begin your low soothing. So that would be your holding, your rocking, your bouncing, whatever it is that you're trying to transition into. When you get to your stress point, which can be different for different people, some people would be in their low soothing for just a few seconds, and if their baby became frustrated, you would move back to your high soothing. That's actually being latched on so that your baby can suckle and calm and soothe herself back to a calm state. Other people would spend quite a bit more time in low soothing. They might hold and rock their baby, and they might do that for several minutes, even if their baby was frustrated. When you get to your stress point, you move back to your high soothing to calm your baby. But when your baby is still awake, you would stop the latch and move back to your low soothing again. So you're alternating back and forth between babies latched on for comfort to calm and latching off to attempt to rock your baby to sleep. And you keep doing this back and forth until your baby falls asleep in the lower soothing spot. That would be, say, in your arms. Um, as you do this over about 5 to 7 nights, you do continue to try to spend more and more time in your lower soothing spot, less and less time in your higher soothing spot. And generally, after about 5 to 7 bedtimes, your baby is very accepting of your low soothing, which should be rocking, holding, bouncing, or otherwise comforted to sleep in a way besides nursing. Okay, method number 2, happy unlatch time. This is something you will only find at ISIS. I love this. My co-sleep team leader, Erin Evans, who some of you might know, created a method that she dubbed happy crib time, which relates to the process of falling asleep independently, and it's really awesome. It's a slow and soothier, a long range plan, but it's really sweet. And this picture is just amazing that goes along with it. It's so perfect. So this we're calling happy unlatch time. And this, like I said, this is a longer range plan. This is if you're feeling like maybe you're sort of looking down the road, what's to come. You're not in a huge rush. You're wanting to do something that's on the very soothy side. Remember that with long range plans, it is more of a time commitment. It's more of a lifestyle. You do have to be aware that you might run into travel, illness, life transitions that could sort of set you back a little bit, which is fine. You just have to know that it's a little more of a time commitment. So with the happy unlatch, if you'd like, I do still strongly believe it's a good idea to move the calorie nursing about 30 minutes away from your bedtime. If you are not comfortable with that, it's not an absolute, but it can be helpful. And then you would want to begin your bedtime routine, generally in the place your baby is going to be falling asleep, a parent's room or baby's nursery. Room is dim, all ready for bed. And now you're going to introduce happy unlatch time. And happy unlatch time is just exactly what it sounds like. You're holding your baby, staring into her eyes, stroking her cheek, shushing her, humming to her, rubbing her tummy. It's just time spent in your arms, that's very low stress, it's very positive, it's very happy. You start with just a few seconds, and then you're going to move on to your next step in your bedtime routine before any fussing starts, so that this is all staying a very positive association. After you do a few seconds of happy unlatch time, you begin to nurse your baby. If you've moved your calorie nursing, this would be comfort nursing. And so you're doing your comfort nursing to sleep. Okay, so you're still, remember this is slow. You're still nursing your baby to sleep for quite some time in this method. But as you go through this, you're just decreasing your comfort nursing time very slowly each night, and you are increasing your happy unlatched time very slowly each night. So your baby has more and more of this loving, soothing, stroking, touching, snuggling time in your arms, and you have less and less of that bonus nursing time afterwards. And you just make the transition from more happy unlatched time to less comfort nursing time very slowly. If you find you get sort of stuck, like at the very end, your baby might be doing really awesome with happy unlatched time, mellow, calm, and happy in your arms. But if your baby's still continuing to look for just that last tiny suckle just to get over the edge and to sleep, you might want to pair this with a little bit of trading down sleep associations, letting her on and off the breast a little bit at the very end until you get her used to falling asleep completely without any latch on time at all. Okay, so that's happy unlatched time. I love it. Um, okay, and then this, I was joking with Nancy. I said, we need to have a contest here for you ladies. Who can come up with a good name for this that I have been calling my muscle through approach, although um, I'm not quite sure that's the nicest way to say it. So option number three. Yeah.
I put the I put rock, bounce, and sway up there because that's a catchphrase I use often to help
Yep.
soothe the baby, or when I'm showing a
Yeah.
mom how to put a baby in a sling or carrier and the baby isn't in love with it right away. I'll say, walk, bounce, and sway, rock, bounce, and sway, big movements. So here
Yep.
you would
Rock,
be
bounce, and
starting with
sway.
a big movement, a big walk around the room or bouncing on the physio ball, and then bring it
Yeah,
down,
so
over time to a more
this
gentle
method is if
sway
you're
or
feeling
rocking in
like,
the chair.
okay, I
So
need to
I don't know. That's
change
what I put
and
up
I
there,
am
rock, bounce,
not,
and sway. But that's still
definitely
to
not
me.
going to
Yeah,
be,
could be
closing the door on
adapted.
my baby and letting him figure it out by himself. But I still do need to kind of do this kind of quickly because of what, life circumstances. You have many children, have a work need, you have to be away, or, so this is definitely an option that's faster. In this particular style, you move your calorie nursing again 30 minutes away from bedtime. You begin your bedtime routine nice and calm and comforting. You may still, if you'd like, keep that comfort dessert nursing session as part of the bedtime routine if you'd like. You do not have to. When your bedtime routine has ended, your baby must very much be aware that the comfort nursing session is over, and now you just do it. You hold, you rock, you bounce, you snuggle, you love. Your baby is in your arms. Your baby, yes, might be frustrated, might be wriggling like a little rattlesnake trying to get into your shirt, but you've got sleep biology working in your favor, the increase of sleep pressure, increase of sleep hormones, and you know that your baby will fall asleep and your baby never left your arms. It could take, with any of these methods, whenever you're trying to make a change, although you have sleep pressure working in your favor, it still might take quite some time for your baby to fall asleep. And so if you're sort of envisioning how this might go for you, it may be an hour of practice while you're doing this at bedtime. I mean, it could take a while, but still, this would be quite quick. Generally, about 3 nights, your baby would become accepting of your new bedtime routine and your new soothing. which, again, might be bouncing, rocking, swaying, as Nancy was saying. You're doing big movements at first, probably to calm your baby. You might be moving around your baby's room, but then always trying to taper that down, slow your movements, trying to do a little less and a little less until baby falls asleep in your arms. Remember, you are still rocking your baby to sleep. Your baby will still rely on you to fall asleep. This is sort of your jumping off point to fully independent sleep. Okay, this is a really great approach too. It's quick, supportive, and effective. Okay, and then your final option is sort of your ultra slow, baby steps, slowest of goals. This is, maybe you have a newborn baby and you're thinking sort of long term. Maybe you have an older baby and you're really in no rush. Maybe you're doing bed sharing and you don't really have a timeline. You just know that at some point you're going to be ready to make a change. So this would be sort of a plan to make the most gentle transition. The time to success for a plan like this, depending on how many goals you set for yourself and how quickly you're working through your goals, would be many weeks to perhaps even months. To start, you want to make your list of goals, and it is actually helpful if you write them down. And generally, your first goal would simply be learning to unlatch your baby without protest. In this first goal, you would still be nursing your baby to sleep, and you'd still be doing this at bedtime. The only thing you'd be practicing would be just try to get a finger in the corner of your baby's mouth and try to undo the latch. And just practice doing this. If your baby sort of starts to fuss and wriggle, go ahead and let him right back on. Nurse again. He's getting nice and sleepy. Try to undo the latch again. And you just keep practicing this. You might even practice this for a week until your baby becomes accepting of you undoing the latch. Okay, remember, you're still allowing him back on to nurse. You're still nursing him to sleep. You're just getting comfortable with that, with what it feels like to sort of break that suction and have your baby become comfortable with it. And then your next goal would be learning to break that latch and then rock your baby to sleep. Always, knowing you're allowing latching back on to comfort and soothe, but trying to then stop the latch and practice rocking to sleep. And so you transition through sort of the learning to unlatch, then rocking, rocking to sleep, and then placing into the crib asleep. Rocking to sleepy, then placing in the crib almost asleep, rocking to drowsy. So you sort of have these slow steps that you're working on. You're still doing a bedtime routine. You're still sort of envisioning in your mind what your bedtime routine ending point looks like. Is it after a particular song, a particular story? And then that's when you begin your nighttime nursing, and that's when you begin working on your slow list of goals. You would generally plan to spend at least 1 week on each goal, and with a method like this, you certainly are able to go back and forth between goals as needed for illness, travel, life changes, other circumstances. But that's why having something written down helps you to have your general progress be always moving forward. Okay, and I love how this baby's got the little angel deer lovey, it looks like, and Nancy has this link too to about how and when to introduce a lovey, which, if your baby is old enough, can also be helpful in making this transition into a different type of soothing at bedtime.
Yes, I would say a few points about introducing a lovey, and I know, I'm a fan of introducing a lovey very, very early, perhaps much earlier than you would be comfortable leaving the lovey in the baby's crib, but that's okay. The good time to introduce a lovey is when your baby is young, perhaps even a newborn at 6 weeks or 8 weeks or 10 weeks, and the lovey, like this one, the angel deer lovey, can be tucked in your baby's lap when they're in the car seat in the car, and can be tucked between the two of you during nursing and rocking and cuddling and nurturing times. And as your baby's hands begin to start moving, you know how they love to scritch at you with those little sharp fingernails and pinch and pluck and poke. And then soon as they get older, they want to explore your nostrils and give you a periodontal exam and tug at your earrings. So this way you can redirect their hands to the lovey, and they begin to hold and finger and touch the lovey and begin to connect the association with feeling drowsy and secure and nurtured and loved with holding the lovey. So hopefully it does become that transference object, that comfort object. And then when your baby is old enough, and there's really no hard and fast guideline to share with you on that, I believe the American Academy of Pediatrics recommends nothing in the crib until a year. So no pillows, no blankets, no loveys, no stuffed animals, nada, nada, nada. But many parents feel comfortable leaving a lovey like the Angel Deer lovey in the crib with the baby once your child is no longer swaddled, can turn on his side or roll independently, and can push up on bent arms or
Yeah, no,
straight
I
arms.
mean,
And so
Nancy and I are
probably
pretty much on
from
the same page as far as
5
introducing it
to
early,
6
getting your
months
baby
upward. So
familiar
that's
with
my
it,
take on it. Meg, would you
putting
like
it in your
to give
baby's
your take on
hands
when you might
when
feel
you're
comfortable
nursing.
leaving something the
I
size of a cloth
generally
diaper
tend
or
to be a little more
washcloth like the
conservative and
Angel
would start
Deer in
putting
the
it in
crib
the
with a
crib
baby?
closer to 9 months. And or when you're feeling like your baby's really moving around and good with his or her hands. Your baby might not actually attach to a thing, an object like the Angel Deer, until closer to 9 to 12 months, though some babies do it earlier. So, but yeah, as you're working on these techniques at bedtime, even if you're not ready to put something in the crib, it's great to be sort of having your baby's hands familiarize themselves with what your potential lovey might feel like. Mhm. Right.
Mm-hmm. Yep. And this link shares some information and just some, more safety suggestions in terms of the size and the fact that you want it to be washable and so on. The other tip I just wanted to share is about delatching a baby, and so you can use this method for breastfeeding, but also for bottle feeding, and particularly I share this for pacifiers. And of course, we have a whole webinar on infants, toddlers, and pacifiers with sleep. But sometimes babies wake up because they lose the pacifier. So if they don't have the pacifier may help them fall asleep or soothe, but it's when they lose it or it falls out of their mouth that kind of startles them awake. So some parents actually remove the pacifier before putting the baby down to sleep. And in this case, as Meg was saying, practice delatching your baby so that your baby isn't actually falling asleep nursing with the nipple in the mouth. And one tip for this is if you're breastfeeding, then yes, as Meg said, you want to put your little pinky finger in the corner of the baby's mouth so that you break the suction. But as you remove the nipple, whether it's the breast, the bottle, the pacifier, out of the baby's mouth, use your thumb to press upward on the jaw. Because what you want to do is as you're removing the nipple, you want to press up on the jaw so that it brings the tongue and the mouth closed, and the baby may continue making sucking motions, but will be kind of sucking on their tongue. And if you keep a little gentle pressure there on the bottom jaw, pressing it upward, a lot of times babies will suck 2, 3, 4, 5 times and then kind of settle and relax, as opposed to startling awake because the nipple is gone. So that's just another little trick for you. Okay, I think we have, maybe we can take one or two questions. Here's one. Hold on, let me do my little tricks. It makes it easier to see the question. Not work. Okay, here's one I'll read. My 9-month-old was sleeping through the night until the past couple of weeks. The pediatrician says it's developmental and related to object permanence and separation anxiety. He's now waking up once or twice a night and needs help going back to sleep. Do babies usually have sleep troubles around 9 to 10 months? Do they grow out of this? How can I help them? And I'll let Meg answer that, of course, but I do wonder too if your baby at 9 or 10 months is also doing things
Yeah,
like
I
crawling
agree.
and
I
pulling
mean,
up to a
the
stand, because
pediatrician
that's
would be
also,
following
it's a
this
big
particular
age of
baby's
development
development. I
and
don't
any
like to
major
say, oh, at
developmental
9 months
milestone,
there
in
is a
addition to
sleep
object
disruption that
permanence and
occurs
separation,
because
can have a lot to do
for
with sleep
different
dysfunction.
babies,
So pulling
different
up to a
milestones
stand,
are happening at different
for
times.
example, babies are so motor driven. What do you think, Meg?
I guess I would be curious to know if the baby is falling asleep independently at bedtime, and if did she say, Nancy, if he was sleeping independently, initiating sleep and sleeping through the night independently? Um, yeah. Yeah, I mean, I would take a look back. Sometimes, you may find, oh, oops, if I look back over the last few weeks, I've actually been nursing him to sleep. Oops, I forgot. Or I've been rocking him to sleep or spending a little more
What
time,
you
which,
what you get is what
doing
you
that
get.
from
That's
time to time
what
is
I read. Go
absolutely
ahead.
fine. But if you sort of have gotten back into a habit of totally assisted sleep at bedtime and now it's carrying over into the middle of the night, you might want to just, take a look at that as well and make sure your baby can initiate sleep independently. Check your schedule because 9 months is a time when, if it hasn't already, the third nap would be dropping away, making sure your baby has enough time in the evening to rebuild the sleep pressure to fall asleep quickly and easily. If you're asking your baby to sleep too much, you're asking your baby to sleep like a newborn at 9 months, that could be contributing to some wake up. So definitely some things to take a look at. Also, environment. We're coming into the summer. It's much lighter. Oh gosh, Nancy, I could go on.
Yes. Yep. All right, let's go to the next question. And the reason I said, yes, let's go on is because, Meg, we can go on. So we have to talk. You have to take everything into account: the room environment, the timing. Is it time for the child to go from 3 naps to 2 naps? There's so many different types of factors. In this case, Mom did add in the chat that baby is falling asleep by nursing and has been all along. So it is possible that during lighter sleep stages now, where maybe it wasn't an
Yeah,
issue
I'm surprised it's
two
an
months ago,
answer.
for example, where your baby is more motor driven, or maybe there are some other developmental leaps going on, or separation anxiety, or who knows, your baby is becoming more fully awake and is requesting or needing the nursing in order to fall back asleep because that's the sleep association. So I think you tuned in to the right webinar. To think about finding other ways to help your baby fall asleep, because the whole point of today's webinar is not to discourage nursing at bedtime or nursing your baby to sleep, which is one of the joys of new motherhood. Um, it's for parents who are frustrated with frequent wake ups as the babies get older and older, because the nighttime feeding is not necessarily required nutritionally. It can be a learned requirement metabolically, because the baby's 24-hour metabolic intake has adapted to taking 20% of calories overnight. So I'm not saying that they don't need those calories overnight, but their bodies can learn to take those calories during other times of the day. Therefore, then you can begin to feed them less at night, and so on. Okay, we better move on, because just like Meg can get off on a tangent, so can I. Here's a last question. Can you talk a little bit about babies who need help in the middle of the night but aren't
Yeah.
waking up completely?
And
My baby is five and a
did she
half
say,
months.
is
He
this
gets
baby
upset and
falling
needs
asleep
soothing,
independently
but
at
never wakes
bedtime?
completely. His eyes stay shut, and if I nurse him, he's
Okay.
right back to
Yeah.
sleep and
Um,
quiet. Sometimes I can get away with
this is another
shushing,
case
replacing the
where,
passy,
and I saw
rubbing
some of the
his
chats
chest,
here
but not
too.
usually.
If this is Christine, there it's easy. I mean, not easy, but it's the easiest time to fall asleep at bedtime. So you want
I
to make
don't know.
sure, yep,
Didn't
she's
say.
like falling asleep on his own, awake at bedtime. That's great, but that's only part of the night work. When you get into the middle of the night, there's a dip in the sleep hormones, there's lower sleep pressure, it's harder to reinitiate sleep. You may also be in a REM sleep cycle where babies are, as you guys might know from the webinars, babies are not paralyzed during their REM sleep. So they'll move, they'll grunt, they'll groan. So I would say first make sure your baby's really awake, not just in a REM sleep phase and you're hearing sleep noises, which you're misinterpreting as being awake. So first make sure he really is awake. Um, Second, I would evaluate, is it a habitual feeding that's no longer needed? And so you might wean down the nursing for several nights, just gently and slowly reduce the number of minutes that you're nursing to see if you can reverse that hunger cue if that's become habitual. And then, pair it with reducing your response, whether you're doing it in an ultra slow way or, whether you're trading down some sleep associations, whether you're doing it faster. Here at ISIS, we, offer all different styles for all different families. And, the biggest thing, you get stuck in these patterns in the middle of the night, and it can be harder to change a pattern in the middle of the night than it is at bedtime. So it might require more consistency for more number of nights. But if it's not about food, then you have to go back and check your goals and continue your intervention in the middle of the night as well. Did I answer that? Did I answer the question, Nancy? Uh-oh, did I lose you guys? Oh, Nancy, I think we can't hear you. Oh, there you go. Okay.
Yeah, that would be because my mic isn't on. Yeah, there's like this button, technology, you got to push it. Okay, so sorry about that. Last question because we're already over
Yeah, and
time, but
yeah,
I think
you
this one
can,
should
and
be
it's also too,
relatively quick.
like I
This
said
mom
too
wants to
in
know, she
in
doesn't
the
say how old her baby
frequently
is,
asked
but she
questions
says if
about
the
trading
baby
down sleep
can go into the
associations,
crib
you
drowsy but
might be at
awake, how
different
to break
points of
nighttime
suiting at
nursing
different
for an
times of
older
the night.
baby.
You might be working on one set of
So
goals at
I would
bedtime
imagine,
and a
Meg, that you
different set
would
of
then
goals in the middle of the night. That's
set
okay.
your
It
goal and
requires a
begin
little
this
planning and
technique
thought, so you don't get
probably at
confused in
the
the middle of the
first
night. But
nighttime waking.
yeah, it's just
Would that
that
be correct?
it's different. It's a little bit hard. It can be a little bit harder for your baby to get back to sleep in the middle of the night. So you just plan to be nice and consistent. And I just wanted to say to Christine too, Christine, because I saw you mention this a couple of times in channeling your inner Meg. Um, you know, I I don't want you to feel like you have to have your 5.5-month-old in the crib all night long, or that there's anything wrong with bed sharing and nursing in the night if that's what you guys feel comfortable doing. Nancy and I can't officially recommend that, but yep, there you go. I just stopped bed sharing and night nursing with Hannah last month. She's my baby, and I loved every minute of it from about 3 or 4 in the morning on. That's what we did. So don't be fooled by me. I help people do lots of things that might not be, what I do, and that's okay too. Yeah.
Yes, we focus on what are your goals, what are your needs, and within that, what is developmentally appropriate, safe, reasonable, kind, and nurturing. Kind and nurturing to the baby, and kind and nurturing to the parent. And different people have different needs and different parenting styles. And there are just some things, there are some things that just aren't appropriate. You can't take an 8-week-old baby and expect that baby to sleep 12 hours at night with no feedings, or you can't expect to teach a 5-month-old baby to sleep with no feedings and also have it happen very quickly and also have it with no crying. So we try to manage people's expectations, what is going to be reasonable and achievable, nurturing, developmentally appropriate, and still meet the needs of the family. I love this picture here that I have to call out this picture because this mom sent it to me yesterday. It's herself 30 years ago. And the cool thing about it is this is one of my followers who's a lovely
Very cool.
mom online who asks lots of questions and shares lots of support to others. And she's in Australia.
I think
I
I
just
have
love the
Understandable. Probably
international
had the beady
reach of
eyes
these
and the buttons and the
webinars and
suspenders and all those
Twitter
things that have been
and
recalled
social
years ago.
media overall, the fact that we can share support so much further these days. So here is a 30-year-old picture of
Yeah.
a woman in Australia who enjoys our information online. So there you have it. We are here and we are able to help you. Yes, isn't that cool? And it's amazing how babies just look the same, even in Australia, even 30 years ago. Yeah, me too. Me too. And it was probably hand crocheted by a great auntie, right? Because I think I had it too. All right, we're here. We're here. ISIS is here. We can talk to you by phone anywhere in the United States, internationally. We've done Skype. We understand time zones, and all you need to do is pick up the phone. And when you call, by the way, don't worry that you're calling and something is going to happen right away, or that you're going to make your appointment right away. Calling this number initiates a request for a sleep consult, which usually occurs within 3 to 7 days. So there's a lot of homework that you need to do on your end in terms of completing an intake form, providing some detailed information, and so on. You don't even have to set up your appointment the
I
day and
believe that we
time
are.
when you call. You just
Yes.
call and start that process. Okay, and then next week, and this is another picture I just have to have up here to show you. I just find this baby delicious. I just want to kiss those cheeks. She is just delicious. And look at her Webinub right there next to her. That's another product that Meg and I like. Okay, so next week, I believe, are we going to talk about toddler fears next week, Meg? Is that what's on our agenda? Well, that's what we're going to talk about. So we're going to do it. And those of you who still have younger babies, this is still a good topic for you because all the time I get questions from moms with 3 and 6 month olds who want to know why their baby cries out or cries in the middle of the night but still seems to be asleep, and are they having a bad dream? And then, of course, same thing, parents asking about the 12 to 24 month old who's up in the middle of the night awake, eyes open, but seeming to be like in a foreign state, not really there. So we'll talk a little bit about dreams, what little we know actually about how babies and toddlers dream, but we'll talk about what happens in sleep, and we'll talk about night fears versus night terrors, and a little info about that. So we wish you a wonderful week of nurturing and safe sleep. On Thursday, please join us for the breastfeeding and pumping webinar. And last week, I did the first days of breastfeeding in the hospital. And this Thursday, I'm going to talk about the early days at home.
Thank you.
So, for example, days 3 to 7, managing some of the early challenges that come up. So even if you're beyond those days, please come and share some support for the brand new moms. And please tell any pregnant, expectant friends that you have, because that's a good one to tune in on. Everybody have a wonderful week. Thank you so much. We had a wonderful turnout. Please spread the word. Tell your pediatricians, tell your mom's group friends, put it on Facebook. Bye, everyone. Thank you, Meg. Enjoy Florida.